Hello, good morning. Today I want to share one case with you, and the case is of gout. This is a case of a 46-year-old male who came with a complaint of pain in knee and small joint of his hands. He explained that he has pain in hands and knee, and he has taken allopathic medicines for it, but with that he is facing side effects like he feels acidity and he feels lethargic, doesn't feel fresh at all. This was his presenting complaint when he came, and I asked him, since how long you've been facing this problem. So he said it's been around 15 years. I have this pain off and on. So I inquired, what is the main problem you are facing due to this pain? He explained that I don't feel fresh. I push myself every day to work. Most of the time, I avoid doing things which are unimportant. I try to postpone. I don't feel that much fresh in the morning or when I come back from office. So I asked when this all started, and when you were facing these problems, when this problem started, any other, like any challenges you were facing or something. So he said, I had no job at that point of time. I had two kids, wife and a family to look after, and I was struggling with this. A main thing was that in my mind was like, will I be able to provide all the necessities to my family? My two children are studying. Will I be able to give them better education? Will I be able to have that much amount of money to provide them food and to give the rent for the house and everything? What are the basic necessities for a family? So I was struggling with that. When I was not having job, this was the main thing which was my focus at that point of time. So I asked, what, how do you manage when you have a lot of pain? So he said, I just go to medical shop. Doctor has prescribed me medicines. I take them. With that medicines, the pain reduces, or swelling reduces a little, but it comes back. I can't walk in the pain. It is difficult for me to work. And he has a touring job, so it is again difficult for me to travel for long distance and bear the pain. Sometimes in the evening there's a lot of swelling in the joints, so it becomes really hard for me to work, to do daily things for my own. So he added, sometimes I take alcohol. With the alcohol, sometimes the pain reduces. So I'm not very sure it is due to the alcohol or sometimes due to medicine it reduces. I said, okay. So on this basis, I analyzed the case. The main first rubric which I took was bed remain desire for, because when he said I don't feel fresh and I postpone the things if they are not necessary. So he wants to stay in the comfortable position or the comfortable zone when he's not working. In the morning, he takes 10-15 minutes to make up his mind to get up out of the bed. So, this was the first rubric which I took. Second, he described that when he had no job, he was completely insecure about his future. So, second rubric which was taken was mind, insecurity, mental, and he was completely insecure about his future, about himself. That, and the third rubric was anxiety, success anxiety from doubt about. He had a lot of doubts about himself. like, will I be able to provide the food? Will I be able to manage the funds for education? Will I be able to pay the rent? What if I don't get the job? So he was completely anxious about himself, about his success. Will he be able to do it? Lot of doubts about himself. So this was the third rubric which was taken, and this is one of the main rubric of ruta, the medicine which I gave him. I gave him 30 doses, three doses of ruta 30, and in 3 or 4 days he gave me the follow up that my swelling has reduced and my pain has reduced. I am feeling better. And there is another rubric to ruta. When you have pains or leg pain, maybe pain in hands, pain anywhere, pain in the joints. So one thing is there that you are not able to move so freely. Another rubric is of ruta is having the rubric is delusion hindered is. Hindered means when you're not able to move, or there is a hurdle in your flow. Like when you're moving, there is hindrance. Hindrance means you stop and then you walk, or you walk very slowly and then you do your work. So this is also another rubric which you can take in ruta. And one more rubric is like a ruta patient is always in his future. He's always thinking about his future, anxiety future about. Ruta is in that also, which this patient was having the feeling of, will I be able to do it? Will I be able to get a job? Will I be able to provide the food and the educational funds for my children? So this was ruta. I got from the, I was able to get into the case from the one main thing which he said, that when I didn't had the job, I was just thinking about my future. How will I do it? Will I be able to provide the necessities to my family? So that was the main rubric from where I entered. And by when I put this all in the um, repertory, I got ruta. And ruta is very good medicine for arthritis and, you know, mm, pain in leg. Maybe you can give in sciatica also when the person feels hindrance in walking or doing everyday work. So this was the case. Thank you.